Hello everyone, this is NainaMD, Fusion of Science and Beauty in Beverly Hills, bringing you the best of anti-aging and regenerative medicine. And I have my next guest. She's fabulous. She's a board-certified gynecologist, and she's going to talk to you about a subject that you probably haven't heard of again. The subject is going to be about pellet therapy. And no one's ever heard about hormone replacement, pellet therapy, or bioidentical hormones.
Right.
Dr. Gail Jacobson, welcome.
Thank you so much. Thank you for having me. I'm so happy to be
so
here.
glad that you were able to take time out of your busy schedule to be here. And I think it's so important for the audience to understand that, you know, when we do bioidentical hormone replacement therapy, it's not just being the steroid doctor or a quack doctor. We have, you know, board-certified gynecologists. We have a tremendous evidence-based science behind what we're doing.
Correct.
And I think I just want you to just talk about that. In particular, you've been practicing, you know, over 25 years.
Yes.
And to be able to just say what you have made that transition, what you saw, and how bioidentical, which is, you know, the yam-based, our own body's exact same molecular structure is so different from the synthetic-based.
Yes.
And as a gynecologist, it would have been a, so to speak, you would have been more critical than anyone to have even wanted to even consider this therapy. So please discuss that and inform the audience about this. And in particular, we'll get into the pellet therapy then.
Oh,
yeah?
sure. I'd love to. Well, I'm board certified, as you suggested, in obstetrics and gynecology.
Yeah.
So I delivered babies and did traditional obstetrics and gynecology for about 25 years. But like during my last 10 years, I noticed something. As my patients transitioned into menopause, I felt that what was available for them, the chemicals, the things that I wrote prescriptions for that they picked up at their regular drugstore, it wasn't enough. They didn't get results, and I didn't feel it was safe. So I took the time and I did the research, because this was not taught to us in our specialty.
No, it's
this was
never
not taught
to
in
us.
our books.
Yes.
So I think one thing that when ladies ask about this and they go to their traditional gynecologist and the gynecologists are not familiar, they have to understand that this was not taught in our, as a part of our curriculum.
That's
so
right.
I was interested in something for my patients, to offer them something that was safe, something that was effective. And then I wanted something for myself. I was pretty selfish. So I wanted something for myself as I transitioned into menopause, so I could continue the life, the vibrant life I was living before.
Yeah, yeah. What is, when we talk about bioidentical hormone replacement therapy, and you know that's a passion that I share with you. We have so many patients that we do. You know, people don't understand the conventional therapies, for example, have been the oral replacement.
Correct.
And I think that there's a huge difference between the oral replacement, where you can actually activate the clotting factors, which then can lead to what we call the risk for heart disease, the risk for stroke, because it's metabolized through the liver.
Correct.
And the bioidentical hormones, which I generally prescribe, are the ones that I use generally like creams, the skin delivery, which avoids that first pass effect of the liver. Okay. So, and sometimes I do sublingual, but you do something a little bit more unique, and that is called pellet therapy.
Yes.
And people are just not familiar with pellet therapy. It shouldn't be looked at, again, taking it out of context, because I want to set it for the people who are quick to criticize, is that pellet therapy for a hormone replacement therapy has been FDA approved for 50 years. Okay?
Exactly.
It's been around. Now, what did we do different? Compounded it, into bioidentical, rather than using a synthetic hormone that we would insert as a pellet. What you found, or what we're finding out, is that we can actually use bioidentical hormones and then insert the pellets.
Yes.
Correct?
Correct.
So having said that, just tell me a little bit about it.
Yes.
What have you found? How did you even, you know, even consider doing pellet therapy?
Well, when I became aware of bioidentical hormones, and that, as you said, are hormones made from yam, what was available at that time that I was aware of were pills and creams, like you suggested. With the pills, again, you need to involve the liver, and like, hey, save the liver for a glass of champagne, right? Why tax the liver for drugs? And creams, which are not quite as predictable and not quite as effective. So I became aware of the bioidentical hormones in the form of pellets. And as you suggested, they've been around 50 years.
Right.
Inserting meds underneath your skin with that delivery method has been around. So this is not new.
And it's just underneath the skin.
Underneath
Again, I want to
your
just educate the audience. It's not like we're going deep down into below the muscular thing. It's just like you just go underneath the skin. Just like the way a diabetic would shoot a syringe, subcute. It's called subcutaneous.
Correct.
Just under the skin.
Correct. And in the hip area. So I hide in your little bikini line. So I'm going to make you bikini ready. If you choose to wear a bikini or not, that's up to you.
Yeah.
But I'm going to make you ready.
Yeah.
So they're slowly released throughout your system over 4 to 6 months.
Yeah.
So it results a day and a half to a week. So the reason I selected this, well, first of all, I don't have time to try to figure out a 4 times a day dosing or cream here, cream there. My ladies who come to me are busy.
Yeah.
They travel and they just don't have the time, and they want the consistency of the effectiveness, because because the hormones in the form of pellets deliver consistently for 4 to 6 months, they don't have to worry about the swings and the peaks and the drops in their hormone levels.
Right.
They're always on target, always ready to go. So I was looking for something safer because it bypassed the liver, and because I insert it directly into your system, I can use a lot less hormones to get a much better result.
Right.
Yeah.
And I think it's important to mention that even in bioidentical hormones, there's various amounts, and we look at the fact that they're soy-based and they're yam-based. We tend to choose a yam-based because we don't want to mix with, soy-based can be GMO.
Right.
It can be, we don't know if it's non-GMO or not, or the sourcing can get to be an issue.
Right.
So we look at the yam-based, and I think that's an important distinguishing, thing. So every detail really is looked at when you're inserting these pellets. And a lot of the pellets they're pressure and infused. They're like under pressure. They're made so that they hold together. It's not like something that they're going to just break, because that's one of the things that people wonder. Oh, well, gosh, if you put something under my skin, is it just going to just break apart? Right. It's slow release.
And it's more importantly, it's individualized. Absolutely. Because your desires for your desires.
So you can vary the dose. On each particular person, you can vary the dose.
Exactly. Yeah. So what I do is we draw the blood, and we don't treat blood work. We then, more importantly, listen to your symptoms.
Exactly.
And we want to see what you desire. So sometimes there are women who've had a history of breast cancer, in their family history of breast cancer. So they want as little estrogen as possible. Right. So we individualize it for you.
You might want to minimize in the estrogen, but you might want to maybe still continue some of the other hormones.
Exactly.
So that's how you customize it. No, I think that's so important, and I think the other thing too is realizing that each individual, right, has its own genetic makeup.
Correct.
And if you that's why I love the compounded pellets, and I love the fact that you do those, because when you do this, just a traditional, there's just standard dosing.
Correct.
You can't add, you can't do anything. It's just there. It's fixed. This one you can personalize. You can say, okay, I'm going to use this dosing on this person. I'm going to use this dosing on this particular person because of their issues, and therefore you have a much more predictable, safer regimen.
And we can change it within the person. So maybe at one time, especially as women transition through menopause,
that's another thing, that way, because they're going through these highs and lows, right? So you don't know if you're catching that woman here, and then maybe the next time around she either doesn't need as much, or maybe she needed more. So you can change that. Yeah.
And if they're in their late 40s, they may require more testosterone, less estrogen. As they transition into 50s, then we would increase the estrogen. Yeah. So it's very individualized, very personalized for the public in general and for that person, depending on what your needs are at that time.
Why is it? It always makes me is why is it that we have not initiated larger, because there's no funding for these kind of studies.
Correct.
And so when people say, well, where's the studies?
Right.
Well, first of all, a lot of the studies, as you and I have reviewed, and the conventional studies were done using either the wrong distribution, the endpoints were not defined clearly. That's why the World Health Initiative, you can imagine all the problems that study had. So tell me, even when they did do a cohort of like 15, 20,000, there were so many problems in those studies, correct?
Correct.
And so I feel that if you even have a smaller study, which a lot of the bioidentical hormone replacement therapy, in terms of all of that, has smaller studies that they've looked at, but they use the right distribution model.
Correct.
I've been a mathematician, so I look at that very carefully. So if you use the right distribution model, you're getting a much better, clearer picture, and a much better, what I would say, an understanding, and a better study.
And more practically, in my practice, the risk a woman developing breast cancer is 1 in 8. The incidence of breast cancer in my practice is way below. I should have.
In my experience too,
exactly.
It's been because again we're not giving it orally, and of course we education of how to avoid xenoestrogens, right? We're in an environment of all the xenoestrogens, which are estrogens from the environment, correct? And then that's what your liver has to process in addition. So now you're giving a pill, traditionally, and you're having to absorb all what the environment is giving to you.
Correct.
Right?
Correct.
You minimize that.
Yes.
And so listen, how do people look you up? How do people find you? Because you are phenomenal in what you do. I know you're an author. You're you're a TV host. You do everything.
Correct.
And you're in the Santa Monica area. You've got a tremendous practice. I've seen it. It's fabulous. Your place is fabulous, by the way.
Thank you.
And how do people find you?
Well, the best way is my website, which is www.drgailjackson.com, and it's spelled DRGAIL Jackson.com, and our phone number 310-451-2300.
That's a pretty easy number.
Yeah.
So,
www.drgailjackson that's the website, and or info@drgailjackson.com, and 310-451-2300. That's how we're found.
That I think you're going to find that people are going to start to, more and more people are seeking this. Is that what you've seen the trend?
I do.
Yeah.
It's word of mouth, and people are seeing the results because.
Tell me a story. Tell me a real. I know we're running out of time. Quick, 30-second story if you can.
Woman coming in, 49 years old, just no energy, decreased libido, married for 20 years, loves her husband. Just where did my desire for sex go?
Yeah.
Can't remember anything. Losing her curves, doesn't want to go to the gym, losing her energy, and wants some help. Beginning to have hot flashes. So with her, I would get her blood work, listen to her symptoms, and I would probably start with a small amount of estrogen and a full dose of testosterone. Oh my goodness, transitional. One of my patients says, she said her life before hormone balancing was in black and white, and afterward it's like she lives in vibrant technicolor. So let's all live in vibrant technicolor.
Listen, thank you so much for coming on my show. I would definitely need to bring you back because you mentioned about you treat males too, right?
Yes, we have to treat their partners.
Partners, right?
Right.
And we haven't even touched on that subject. And I want to talk to you about how you can give testosterone safely with all these studies that are coming out about testosterone in males, right? We need to get into all of that in the next show. You promise to come back?
I promise. Thanks for having me.
Thank you so much for being on my show, and I know you're going to come back because we have to talk about the males, correct?
Yeah, we have to balance their partners.
We have to balance their partners, and there's a lot of controversy surrounding that. We want to show, I think, the audience how that can be done in a very safe and effective manner, correct?
I look forward to it.
Absolutely. And anyone, if you want to hit me up too, it's at NainaMD, NainaMD.com, or info@NainaMD.com, 310-777-7511. Thank you, everyone. See you next week. NainaMD, Fusion of Science and Beauty in Beverly Hills.